Good morning, everyone. It's my pleasure to open the second session on yoga, which is a part of our series on webinars on health and wellness in the post COVID era, especially focused on healthcare and frontline workers that have been grappling with the ongoing epidemic or pandemic of the last 1 year. This has been a particularly stressful period to everyone in this world, even though the United States, thankfully, is showing a flattening of the pandemic curve. We can't say the same thing about the rest of the world. Um, as we mentioned the last time, the SAMHSA, the Substance Abuse and Mental Health Administration, has allowed us to provide this series on wellness. And the last session was focused on some interactive exercises and discussion about yoga as a way of building resilience and reducing distress in people who are dealing with various aspects of the pandemic. And the pandemic has affected almost every one of our lives in many different ways. It is a large natural experiment in the world of how to build our resilience and how to manage stress. Very briefly, one can address this ongoing stress by either reducing stress factors by such initiatives such as the vaccine and personal hygiene and social distancing and so forth. Another important aspect of addressing stress and building resilience is to enhance our protective factors like social connectedness and care for general health, building our immunity, and so forth. And third and most important is building our own inner core resilience of our how to address stress. As Dr. Shivaram last times very nicely pointed out, stress is not that something that is out there. Stress is how we respond to the outside events. And how we respond to outside events depends on the kinds of skill sets that we build and use. And there are many of these approaches, including mindfulness, sleep hygiene, yoga, exercises, and so forth. And this series brings a number of those to you. And the last session and this session are focused on yoga, being taught by what I might say are the world's best group of scientific researchers, all of whom are physicians and psychiatrists that have done painstaking research over the last several decades on understanding what yoga offers and also how effective yoga is in improving health and well-being. As you all know, health is not simply absence of disease, but a positive sense of well-being. And this is what yoga is built on. Let me briefly introduce the three speakers before I get the stage on to Dr. Gangadhar. Dr. Gangadhar is a friend of mine for the last over 3 decades and is a friend, guide, and philosopher. He was the director of the National Institute of Mental Health and Neurosciences in Bangalore in India till about last year, and is now the director of medical ethics for the government of India. So he is a leader in many different ways. And his work on yoga has been well known worldwide. Now, you saw Hemant Bhargav last time. Hemant is a physician who is also a yoga practitioner and a yoga teacher. So he's kind of dually trained, both in yoga and in medicine and psychiatry. So he will again teach you by role modeling how to use some of these exercises of yoga in your day-to-day life. Shivaram Varambali is the head of the Department of Integrative Medicine in the National Institute of Mental Health and Neurosciences, and along with Gangadhar, has conducted some of the most cutting edge frontline research on yoga and its application to mental health. With that as a background, let me now get the stage to Dr. B.N. Gangadhar. Gangadhar, take it away.
Oh, thanks, Keshavan. I did go through the last session on Tuesday. I saw that there were several issues that we discussed. One about stress. The other is some principles of yoga. The third was some simple yoga practices which could be practiced by most people with 1 or 2 sessions of observation. And I also gather that looking at the feedback, people felt that those were useful. The entire webinar has been very well planned in the background of what we call as the International Day of Yoga, which we are observing on 21st of June, the Monday, a few days later. So it is very appropriate that as a part of what we may call as worldwide celebrations on yoga, your team has timed it so well that it will be one of the programs which will culminate into the International Day of Yoga, which NIMHANS has been doing in many other areas as well. So it's to be appreciated. I also would like to congratulate your team having timed it so perfectly that it clicks. This is number one. The second issue is the whole program on yoga has been planned in the background of a pandemic of stress. Pandemic of stress. While most of the time we talk of an infective disease leading to a pandemic, but we perhaps may not pay attention to the mental health issues that it brings along. Although mental illness itself is not infective in that biological sense, but mood states can quickly infect the other individual. When I am happy, it's likely that my family will be happy, my daughter or my son or whoever it is will share that happiness from me, and vice versa. I am down, he or she will also feel down. So while we may not want to call mental health or mental states as infective in the infection or illness related connotation, but mood is a all pervasive communicable form of emotion. So in the context of COVID pandemic, there were several things that have happened. It is not just somebody getting a COVID infection, developing a respiratory illness, and then some having to go on ventilators, some getting out of it totally. There were a plethora of social and psychological events that have come up. Social, when I am talking of, there were several COVID appropriate behaviors which have to be enforced by the state, making you wear the mask, making you keep away from a distance, from another individual, not crowd, the buses, aircrafts, traveling across from one place to another, uh, shops, malls, uh, many things closed. Entertainment came to a halt in terms of what we had all been used to in the last few months. My earnings went down, my education went down, many exams got changed, many examinations postponed, schools and colleges closed. So there was a plethora of social effects of COVID pandemic that happened. A social change is something that we may not have been prepared with. All of us may not be well resilient to be able to bear all these changes that happened all of a sudden. In the background of these social changes also came psychological changes. A person who is infected with COVID was largely stigmatized in the society, and that may give a brunt on him. Individuals wouldn't touch him, wouldn't even let him come closer once he is infected. And the doctors who were treating him wouldn't even show their face. They were all masked and went into those PPE kits. The face-to-face interaction with the doctor, which usually makes the patient very reassured, that went away. And so the anxiety built up. What if I get COVID? Is the anxiety that pervaded the entire society. And once somebody in the family gets infected with COVID, well, I will also get infected. If a office where one of the members has been infected, and the whole office numbers of people will feel the same thing, that what if I get the infection? That fear of getting infected, fear of the consequences of infection. Yes, 95% of them would come out without any problem, but those 5% who had a serious outcomes of COVID infection haunted all our memories, and we thought we would get affected. And the test, what if test becomes negative? The swab is made, and 2, 3, 4 days later, I would get the report. In this period, I will be very tense. I have gotten in touch, in contact with a COVID subject, and I will be told that I can be tested only after 6, 7, 8 days. Until then, your swab may not be very sensitive to be picking up COVID infection in you. So for those 7, 8 days, you remain quarantined. You remain untouchable in a way. This would also produce quite a bit of psychological concerns. In these 7, 8 days, I'll be continuously worried that I'm going to be infected with COVID. So a cycle of events which lead to a person continuously under stress. As was discussed yesterday by Dr. Shivaram Varamballi, stress is something that we all have to face at some point of time or other. And most of us have learned the way in which we overcome the stress. And for a lot of us, luckily, the event that causes stress usually goes away and we feel very relieved. It is not that for days together you are under pressure of some worry, some tension, some concern, some anguish, anxiety, uncertainty, which had pervaded the entire society, making people very, very stressful. And this pervasive and long standing continuous feelings of concern and stress is the one that actually will be injurious to one's health. And this is precisely what most of the stress physiology researchers have been talking about. The longer it remains, and you are going to be affected. And so came up with the lifestyle changes which we alluded to in the discussion by Dr. Hemant Bhargav, how multiple layers of our body have an impact on our psyche and also the well-being. The mind, manomaya kosha, which is what is perturbed in the COVID pandemic area, emotionally charged, which remains continuously so, makes our physiology change, and then this physiology leads to adverse effects. And so amongst the lifestyle changes that we have all been talking about, we saw yoga. Yoga generally is believed by most people as another physical activity, another exercise, some postures, some bending, some stretching, some breathing. Yeah, these have all made a change in this individual. But actually, if one looks into the yoga principles, yoga says chitta vritti nirodha. In other words, the haunting thoughts which are pervasive, which are worrying me, are something to be put a stop to, is what is going to result from yoga. So, in other words, yoga is not, although we are talking about the asanas, pranayamas, the postures, etc., the primary effect is use my will to control myself and to help the will use these physical exercises or the postures. The entire yoga practice is a way to empower oneself to be able to master one's mind. And that mastery of one's mind, in effect, cascades into mastery of well-being and good health. And in the process, we use many techniques. Some of them are meditative, some of them are breathing, some of them are asanas, and some of them are mere morals of living. 10 important commandments that have been given in the Yoga Shastra. So, in effect, yoga is a way in which I am empowered to master myself through mastering my mind. Chitta vritti nirodha. This continuous efforts by myself will help me to get over the effects of the stress and the mindful practice of yoga postures, synchronizing them with the breathing processes. So continuously applying my mind onto these yoga effects is what is going to bring benefits of yoga. And that's what we have seen. I will now request Dr. Hemant Bhargav to talk about some techniques to reduce depression, some techniques to improve sleep, demonstrate to them. And towards the end of the session, we will have some questions to answer. And I will conclude by indicating why and what is the scientific support for practicing yoga, at least in mental health conditions. So I'll request Hemant to come on. Hemant.
Thank you, sir. Good evening, good morning, all of you. In the last session, we discussed about the practices that may be useful in reducing stress. As said by BNG sir, another very important problem that we have been facing during this pandemic is anxiety. Anxiety is one of the most prevalent kind of psychological morbidity that has developed. In the poll that we had on 15th, we saw that 100% of the audience here reported that they suffered from stress in the last 1 year. And then in the poll, it was observed that almost 69% of the people reported that they felt anxious. So therefore, we decided that we will focus on the anxiety related techniques of yoga. Now, the yoga capsule for anxiety, before we go into actual practice, I would just like to give you an overview of how yoga looks at anxiety. In the last session, we discussed that there are 5 layers of existence, and as suggested by BNG sir, it is the 3rd layer, the Manomaya Kosha, the layer of emotions that gets disturbed. In anxiety, there is an anticipation of threat. And with this anticipation, a thought pattern, which is associated with a lot of fear, repeats in the mind again and again. Yoga understands this as a thought pattern caused due to intense attachment or aversion. A famous yoga text called Patanjali Yoga Sutra describes anxiety as abhinivesha, and it suggests that the root cause for anxiety is raga and dvesha. Raga means strong liking in the sense organs, and dvesha means a strong dislike. So all our fear is about, what if I cannot get what I want? Or what if I have to go through what I don't want? So this raga and dvesha are considered as the root cause of anxiety and fear according to yoga, and therefore the practices focus on bringing mindfulness into the practices, bringing the mind into the present moment. The key point or the thought that revolves in the mind is associated with what if, and it always takes the mind into the future. So the key here is to bring the mind back to the present. Therefore, synchronization of the breath with the body is very important. Becoming aware of the sensations in the body is very important. And as I suggested in the last class, that all yoga practices are kind of a mild stressor. If we are able to do those practices with a relaxed, calm mind, with a gentle, smiling face, it enhances our endurance, our resilience to tolerate the stressful situations better. So with this background, I will begin the yoga capsule for anxiety. These are some instructions. These practices can be done once or twice a day. To have a sustained effect, they should be done at least 3 times per week. Also, the practices should be performed with a loose, comfortable dress, and it is preferable, especially when you are performing the fast breathing practices, that you are in an empty stomach condition, that is 2 hours after full meal or 1 hour after a snack. So let us get ready. I would encourage all of you to actually practice this with me, so that you can actually experience that relaxation, that calmness of the mind. So this capsule starts with some gentle loosening of the neck and the shoulders. Then we open up the chest region by performing hands in and out breathing. And after that, we perform a specific technique known as the sectional breathing, vibhagiya pranayama, adapting different yogic mudras. A ratio of breathing is followed where the exhalation is prolonged than the inhalation. All these practices ultimately focus on bringing a state of parasympathetic dominance and therefore help in managing anxiety. Let us do the practices now. Sit comfortably with your back and neck erect. Adapt chin mudra with your hands by touching the index finger with the thumb. Keep the other 3 fingers straight and together. Now face your palms down and keep them on your thighs. Close your eyes gently, and now bring the awareness on your breath. We shall perform gentle movements of the neck, synchronizing the neck movement with the breath. Breathe in, look up. Breathe out, come down. Continue this for 5 rounds. Breathe in. Breathe out. Keep the face relaxed. 2 more rounds. Breathe in, relax. After this neck loosening, let us perform the shoulder loosening. Keep your fingers on the shoulder joints, your arms spread. Now take a deep breath in and rotate your shoulders like this. Breathe in, come up. Breathe out, go down. Continue this for 5 cycles. Breathe in, breathe out. Keep the attention on your breath. Breathe in, breathe out. Breathe in, breathe out. One more round. Take a deep breath in, breathe out. Now let us do the same practice in the anti-clockwise direction. Breathe in, breathe out. Breathe in, breathe out. Gentle, deep breathing. Beautiful synchronization of the body and breath. Breathe in, breathe out. Loosen the neck muscles. Last round. Take a deep breath in. And now breathe out. Release, relax. Relax your neck region and the shoulder region. Next practice is known as hands in and out breathing. To perform hands in and out breathing, you can do it on a chair also, or you can come to a standing position, your legs together, hands together in front of you. Take a deep breath in and open your arms. Breathe out and close. Take a deep breath in, breathe out. As you open up your arms, feel in the mind that you accept the life as it is. Breathe out, close. Breathe in, breathe out. One more round. Take a deep breath in, gentle smile on the face. Breathe out. Release and relax. With these 3 preparatory practices, we have synchronized the body, breath, and mind together. And now we shall do some pranayama practices. This practice is very important. It is known as sectional breathing. So for this practice, you can be seated on a chair or you can sit on the ground. Sit in a cross-leg posture. Or if you are sitting on a chair, keep your both the feet firmly on the ground and your legs together. Now, when we perform this particular breathing, there is a component of adopting certain postures with the hand known as mudras. Also, the awareness should be on different parts of the chest. First mudra is known as the chin mudra, where you touch your ring finger to the thumb and other 3 fingers are straight. When you adopt this mudra, your mudra up to the wrist joint should be tight and the whole body should be relaxed. After adopting this mudra, face it down so that you are able to maintain it stable for a long time. Keep your elbows and shoulders relaxed. If you are sitting on a chair, keep it on your thighs. Now, adopting this mudra, we are going to perform breathing in the ratio 1:4:2. It means that we are going to breathe in for 4 counts and then hold the breath for 16 counts and then breathe out for 8 counts. When you breathe in for 4 counts, please remember that it is a single breath that you are taking in a staged manner. So with each count, you fill your lungs with 25% air and you reach 100% by the count 4. While you are breathing out, a single breath is continued in a staged manner so that with each count, you empty your lungs by 12.5%. Let us get ready for sectional breathing. Chin mudra, back and neck erect. Close your eyes. With chin mudra, bring your attention to the lower zone of your chest. Take a deep breath in and hold your breath. You can feel the air into the lower zone of your chest. Breathe out and completely empty your lungs. Now breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Release your mudra. Sit relaxed with your palm facing up. Close your eyes. Bring the attention to the breath. Keep a gentle smiling face. Allow your breathing to settle down naturally. Feel the touch of the air in your nostrils. Appreciate that the air you breathe out is warmer than the air you breathe in. Now the same practice is done with the second mudra, which is known as the Chinmay Mudra. In Chinmay Mudra, you adopt Chin Mudra by touching your thumb to the index finger and then tuck the other 3 fingers in like this. So this is known as the Chinmay Mudra. Face it down, keep it on your thighs, close your eyes. Now with this mudra, you can feel that the awareness naturally moves towards the middle chest. Close your eyes, take a deep breath in and hold your breath. Feel the air into the middle chest. Breathe out and completely empty your lungs. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Release your mudra. Palm facing up. Relax. Gentle smile on the face. Just observe the breath. The last variation of the practice is by adopting a third mudra known as the Adi Mudra. It is very simple. You have to bend your thumb and make a fist like this. Keep the mudra up to the wrist joint tight and the whole body relaxed. Face it down. Keep it on the thighs. Elbows and shoulders relaxed. Close your eyes. With this mudra, naturally you can feel that the awareness and the air moves more towards the upper part of your chest, just below your shoulders. Close your eyes. Take a deep breath in and hold your breath. Feel the air into the upper chest region. Breathe out and completely empty your lungs. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Release. Relax. Face the palm upwards. Close your eyes. Feel the calmness in the mind. Reduction in the speed of the thoughts in the mind. Yoga philosophy says that breath and mind are connected. We can regulate the mind by regulating the breath. Next practice is cooling pranayama. This particular practice is very useful in bringing a sense of coolness and calmness in the mind. Adapt chin mudra, joining your thumb and the index finger, palm facing upwards. Now you have to clench your teeth and try to breathe in from between the teeth. The air should be sucked in like this. And then close your mouth and then breathe out from the nose. Let us all do this practice for 6 rounds. Clench your teeth, suck the air in. Close your mouth, breathe out from the nostrils. Feel the coolness as you breathe in. Breathe in. Breathe out. Breathe in. Breathe out. 2 more rounds. Breathe in. Breathe out. Breathe in. Breathe out. Relax. Feel the coolness in your facial region around your mouth. Keep a gentle smile on the face. The last practice is performing breath awareness in Dhyana Mudra. So here you keep your right hand on the left hand and keep it on your lap. Neck relaxed, eyes closed. In this mudra, bring your awareness towards your breath. Just observe the incoming and outgoing breath. Cool air enters the nostrils as you breathe in. Warm air goes out. Anapanasati, just observing the incoming and outgoing breath without interfering with it. Now from the breath, bring your attention towards your ears and listen to the sounds that are falling into your ears. Non-judgmental listening. Can we hear sound without attaching a thought to the sound? Simple, unbiased listening. Rather than holding on to a particular sound, try to keep open-minded awareness equally distributed to all the sounds around you. Feel the expansion of your consciousness beyond this body. Feel the relaxation in the body, gentleness and the rhythm in your breath, calmness in the mind. This balanced, equanimous state of mind is the key. Try to maintain this state as long as possible. Thank you very much. So with this, we have completed the anxiety capsule. And before I go into the next capsule, I would once again request Gangadhar sir and Shivram sir to come up. The next module is sleep module, and we can have some more discussions.
Yeah. We're going to be showing some more sessions. Is that right, Hemant?
Yes, sir. Yes, sir. So there is one more capsule remaining, which is the sleep capsule. So
go ahead.
Do you think we should do the practice right now, or Shivram sir has any comments?
No, I also wanted to check with like any of the participants can ask questions right now or towards the end of the program as well, because we are also very much interested in what you people think and what do you want to know about the mental health, resilience, or yoga, the practice of yoga. So I would be very happy if people ask questions on the chat box, or if somebody wants to speak out, I think we would be able to do that as well. That's something that we wanted to ask the audience about their own clarifications or questions. So that's something that I want to open up to the whole audience. The second thing is I would want Dr. Gangadhar to maybe expand a little bit on, he did speak a little bit in the first 10 minutes that he spoke about what is the connection between the body and the mind in terms of health, and how yoga, really makes that connection better, or how bodily we see disorders, tend to see them as bodily disorders. So I have a pain, I have a low mood, which produces physical symptoms. Then I say I have back pain or I have a neck pain. But as Hemant explained the other day, the yogic understanding is that even physical disorders start in the mental plane, which they call as the Manomaya Kosha. So how yoga does this, maybe Dr. Gangadhar can briefly speak about this, and meanwhile we'll take any questions from the audience as well.
So Professor Varambali, I just wanted to bring to your attention that we have a participant that does have a question She can either ask it before or after Dr. Gandagar can explain. Either way works.
Okay. Yeah. Would you be
Yes.
able to unmute somebody if somebody wants to ask a question?
Yep, they would just have to raise their hand using the Zoom feature, and I can ask them to unmute and they can ask their question out loud. And we do have a participant ready to ask if you're
Oh,
ready
sure.
for the question.
I think they can go ahead. That would be good.
So thank you so much. Can you hear me okay?
Yes, yes. Please
Good.
go ahead.
So nice to see somebody from India joining us. So I teach Kundalini yoga, and a lot of what you are doing seems to have a lot in similar. So, which is a delight to see. So I am curious, is there a name for the type of yoga that you are teaching? And how can I continue to follow what you do?
Okay, I think Hemant should probably start answering this question. Hemant, what would you call your style of yoga?
I think BNG sir is the best person to talk about
Okay,
generic
no issues.
yoga.
I'll come back. I'll come back.
Okay.
Yoga postures, yoga practices have been well documented in traditional textbooks of yoga. We, for ease of communication, we refer to them as generic yoga. They don't belong to any school. They are the traditional texts which have guided many people. Each person creates a concoction from this and perhaps also add some of their originality and to lead to a school of yoga. And quite often, many of the schools also become patented, or I wouldn't copyrighted, that may perhaps a better word, and they want to be asked, people will ask, which school of yoga you practice? Okay, XYZ school of yoga. But we have always been working on traditional descriptions of yoga practices, which have also figured in the literature, in the textbooks, what effects they produce. And so going back, something like a reverse pharmacology, look at what benefits those, each of those yoga procedures described in traditional textbooks have produced, or at least described to have been produced. We put them all together in terms of a reverse pharmacology to say that this disease would benefit from these sets of yoga practices as a closest association between those benefits and those symptoms which would have occurred in the illnesses. So in this way, we went on to gather 5 or 6 yoga practices which would closely be anti some psychiatric disease, anti some given physical syndrome, whether migraine, for example. So we have developed what we may call as yoga modules. And these modules are something, if you can talk of a pharmacopoeia. It describes a concoction of yoga modules, which we have put them together based on the literature that is available in the traditional texts. And we go on to, of course, test them in clinical trials, and we test them for their biology. And of course, large patient experiences are also documented, including the side effects, ease of practice, and the time limit within which they produce benefits. Put together, we have had about close to 9 or 10 yoga modules having been published already, and a set of them are available as a text material, which is available in our website. And in a day or two, we also will be releasing a compendium of all the yoga modules that we have developed for several conditions. But having said this, a word of caution is that this is not the final set. Each clinician may want to fine tune these yoga modules depending upon an individual and then go on to practice it. The yoga modules are not written for a disease, but we assume that yoga modules have been written for an individual with these symptoms. So from individual to individual, these symptom clusters would vary, and for a given disease with different symptom clusters, a clinician may want to add different modules. So in effect, our yoga modules are not copyrighted. They're available in the text. and they're available for free use. And they're also have the liberty to modify these modules and continue to use it as long as the patients benefit. So Hemant, maybe you can go on, more questions will gather, and we would perhaps come back towards the end by summarizing many of these questions. Yeah, here it is, a textbook on uh, yoga, which we have recently written, has been made available. Science and Art of Yoga in Mental and Neurological Healthcare. This has some of those yoga modules available, and more recently we have also developed a compendium of all the yoga practices, or modules of the conditions that we have prepared. Yeah.
So yeah, just to explain what Dr. Gangadhar has been saying over the last maybe 13, 14 years, we have developed what he described as modules for, say, schizophrenia, major depression, anxiety, obsessive compulsive disorder, opioid dependence syndrome, somatoform pain disorder, and many of these common as well as severe mental disorders. Because we are psychiatrists by training, of course, we have focused mainly on the psychiatric and neurological disorders. I'm sure similar work can be done, has been done actually rather, on diabetes, hypertension, many of the so-called lifestyle disorders, almost all the non-communicable disorders. You know, we could work out yoga models like this, but the most important thing is, as Dr. Gangadhar said, we do agree that it is open to modification by each therapist. But the basic idea is any reasonably trained yoga therapist anywhere in the world should be able to teach these modules. So we don't really encourage people to learn yoga from YouTube or, you know, from a book, because we feel that the several parts of the yoga training, especially the breathing, needs to be taught and needs to be actually imitated. We have done some research on, maybe Dr. Gangadhar will talk about some of the biological research we have done, a system of neurons in the brain which we call as mirror neurons. These mirror neurons are basically a set of neurons that respond to an activity that somebody else is doing. And this is how babies learn, this is how we all learn. And in fact, it is a very critical part of what we call as empathy. So suppose a child is crying, any person, whether educated, not educated, you know, doesn't need to even be from the same place, would actually feel distress looking at the child crying. Now, why is this? You know, I am not hurting, I am not sad, I'm just looking at a child who is crying. This is basically because the neurons in our brain get activated by seeing a child crying, and this is how we recognize emotions in other people. It's a very important component of what we call social cognition. And unfortunately, these are the systems which are affected in autism and schizophrenia. So the person with schizophrenia or autism simply cannot make out what the other person is experiencing. And this leads to a lot of difficulties in day-to-day life. You know, if you can't make out whether your boss or your wife is unhappy with you or happy with you, it's going to lead to a lot of problems. So this is what we feel has to be taught. You have to learn by imitation. Your practice depends on it. So we don't really encourage self-practice, but we do feel any person with a reasonable amount of training in yoga should be able to teach these modules. That's one thing. Second thing is, like Dr. Gangadhar said, we have made these modules and then tried it for initially safety and feasibility, then go on to do clinical trials. And in schizophrenia and depression, to a large extent, we have succeeded in showing that they do improve symptoms as well as a biological substrate for this action in terms of, hormones or, imaging, many things we have used. So this is what we have been doing for the last 10 years. So that's, I think, a part answer to your question. Yeah, so maybe Hemant, now how many, we have half an hour left, do we? Okay, so what maybe we can do now is we could go to the next module. This is something that we have seen in the poll the other day. We did a poll, people who were there on Tuesday would know. They participated in a poll where we were asking a lot of questions about how they have been feeling and what stress they have been feeling and what symptoms of stress they have been feeling. And what we found is that the most common symptom was anxiety, followed by sleep problems. So right now, Hemant is going to demonstrate a module which helps sleep. I think these are the questions. I think, yeah, nice pie chart where we can see, yeah, sleep. I think the biggest one is anxiety. Did we say that? Yeah, anxiety. And then I think sleep, if I'm right. Okay, people also have used the problems with using substances, alcohol, maybe food, and people have dealt with it in various ways, including I was happy to see yoga. So these are something that we wanted your opinions, and that's the basis on which we have chosen the modules that we are going to demonstrate. And what Hemant showed today in the first session was anxiety, what can be done for anxiety. And right now he's going to demonstrate a module that should help people deal with sleep issues. Go ahead, Hemant.
Thank you, sir. I will share my slides. Now, when we talk about sleep, yoga texts actually go in a lot of details into different states of consciousness, especially a Vedic text called as Mandukya Upanishad. It is considered as the smallest of all the Upanishads. It describes 3 states of consciousness: wakeful, dream, and sleep. And it says that there is a 4th state which transcends all the 3. And that state is called as Turiya. So the state of wakefulness has been denoted in the text by the sound A, whereas the state of sleep has been denoted by the sound M, the humming sound. So here, why did the text say that the wakeful state, where the consciousness is moving outwards through the senses, is denoted by the sound A, and why the sleep state, where the consciousness is moving inwards, is denoted by the sound Ma, that is the humming sound? In our day-to-day life also, we observe that whenever there is a spurt of consciousness in outward direction, we tend to produce a sound A. Say, for example, I am lifting a very heavy weight, I tend to produce this sound Ah. Or if somebody suddenly hurts me or pinches me, ouch. So Ah sound naturally comes when the consciousness moves out. Whereas if the consciousness moves in, the sound of that consciousness has been denoted as Ma. Sometimes when we taste a delicacy that we really like, we keep it on the tongue and then we produce the sound, it is yummy. So when we do that, our consciousness is going in, we want to feel it. The humming sound comes. Similarly, when you want to make a baby sleep, the natural sound that comes is, this is the kind of a sound that comes. So in fact, we, in the last session, Shivram sir suggested that the humming component produces a vibratory effect, especially in the auricular branch of the vagus nerve. And through that, it actually deactivates the limbic cortex and calms down the areas of the brain associated with emotional distress. So therefore, in the module also, you will see that we will gradually take the consciousness inwards. So therefore, we will begin with the tiger breathing practice. In fact, all the practices that are there can be done on the bed. So I will do it on the mat and demonstrate it. We will begin with a practice which eases up the muscles in the back and then synchronizes the body and the breath. Then we loosen up the lower back by performing the supine abdominal stretch. Then we perform selective left nostril breathing. Now this selective left nostril breathing has been considered important in bringing a state of parasympathetic dominance. There are a number of researches now, especially by Dr. Shirley Telles, which have demonstrated that selective breathing from right nostril can increase the blood pressure, it can increase the heart rate and sympathetic activity, whereas left nostril breathing can have a calming, relaxing effect by reducing the blood pressure, heart rate, and producing an effect of parasympathetic dominance. Then we perform the humming breath that we actually performed in the stress module also. After that, we perform something called as point meditation or Bindu Dhyana, which is a way of taking the consciousness onto the body and then going within by gentle humming. So let us all practice the sleep module. I would again request all of you to kindly join with me as far as possible. So the first practice is tiger breathing. To do this practice, it is very simple. You assume a table pose. So you sit like this, take a half hand distance between the legs, and then take the same palm forward and then again go one palm ahead and come up. And then you bring your hand, knee, and feet in one straight line. So this tiger breathing should be performed in this table pose. You breathe in, close your eyes, look up, make your back convex upwards, concave upwards, and look up. As you breathe out, the back becomes convex upwards and you breathe out. Breathe in, look up. Breathe out, look down. Consciously try to relax your neck and back muscles. Breathe in, breathe out. Do for 5 rounds, 2 more rounds. Breathe in, breathe out. 1 more round. Breathe in and breathe out. After tiger breathing, we should come to the lying down position, the Shavasana. Now this practice should be performed on the bed just before you want to sleep. So you put the lights off and then relax on your bed, perform tiger breathing, and then come to lying down position. Then we perform supine abdominal stretch. Bend your legs. Keep the legs beside your buttocks. And then spread your hands sideways, palms facing downwards. In this position, close your eyes, take a deep breath in. And as you breathe out, turn your legs to one side and neck to the other side. Feel the twist in your spine and lower back. It is a very good practice for back pain also. At the end of the day, it is nice to relax the back muscles. Relax in this posture. Hold the posture for 5 breaths and consciously in the posture try to relax your back muscles. 1, 2, 3, 4, and 5. Breathe in, come to center. Now breathe out and go to the other side. Legs on one side and the neck turned on the other side. Feel the twist in the lower back. Keep a gentle smile on the face. Maintain without holding the breath. Consciously putting the attention on the lower back and relaxing the muscles. 1, 2, 3, 4, and 5. Breathe in, center. Do this for 3 counts. Breathe out. 1, 2, 3, 4, and 5. Breathe in. Breathe out. 1, 2, 3, 4, and 5. Breathe in, come up To intensify the stretch, you can also cross one leg over another and then again do the same practice. Let us do one round like this. You can cross right over left and then left over right. Take a deep breath in, breathe out and twist. 1, 2, 3, 4, and 5. Breathe in center, breathe out other side. 1, 2, 3, 4, and 5. Breathe in, come to center. And in the same way, you can cross the another leg and do the practice. Release and relax. Palms facing upwards. Completely surrender the whole body weight to the ground. Now, in the lying down posture, we shall perform selective left nostril breathing. For this, the right hand, palm faces upwards in a relaxed way. The left hand, and with the right hand, gently, with the thumb, close the right nostril. Do not press too hard. Close your eyes. Just gently press the right nostril. And breathe in and out only through the left. Try to prolong the air that you breathe out to be longer than the air that you breathe in. Try to maintain a ratio of 2:3, breathing in and out. Deep, slow, rhythmic breaths. Attention on the touch of the air in the nostrils. Perform this for 6 to 9 rounds. 2 more rounds. Last round. Release your hands. Relax. Next practice is the humming breath. When you do this breath, in the mind, consciously withdraw your consciousness from the senses and turn it within, towards your heart. Close the thumb, the ears with the thumb, and then with the other 4 fingers, press on the orbital bone without pressing on the eyes. Cover your eyes completely. Press the tragus of the ear and close your ears with the thumb. Now, touch your tongue gently to the upper palate and produce the humming sound very, very gently. 6 to 9 rounds. Continue. Two more rounds. Release your hands, palms facing upwards. Completely surrender the whole body weight to the ground. Eyes gently closed. Now we shall perform point meditation. Please move your awareness on the points of the body that I call out. Consciously try to relax the point. First, bring a focused attention to the point and then consciously relax it. Slowly bring the awareness to the top of your head, the center of your head, at the top. Pointed awareness, relax it. Now bring the attention to the point at the center between the eyebrows. Focused attention between the eyebrows. Relax it. Pit of the throat. Pointed awareness on the hollow of the throat. Relax it. Center of the right shoulder joint. Relax it. Center of the right elbow joint. Relax. Center of the right wrist. Center of the right palm. Keep relaxing the points after bringing a focused attention. Once again, center of the right wrist joint. Center of the right elbow. Center of the right shoulder. Hollow of the throat. Left shoulder joint. Left elbow. Left wrist joint. Center of the left palm. Left wrist joint. Left elbow. Left shoulder joint. Hollow of the throat. Point just below the chest bone. A soft triangular part just below the sternum bone. Navel region. Center of the pelvic bone. right hip joint, right knee, center of the right knee, relax it. Right ankle joint, center of the sole of the right foot, right ankle joint, right knee, right hip joint, center of the pelvic bone, the pubis symphysis, left hip joint, left knee joint, relax it, left ankle joint, center of the sole of the left foot, left ankle joint, left knee, left hip joint, center of the pelvic bone, navel region, center of the chest, just below the chest bone, hollow of the throat, point between the eyebrows, point at the center of your crown, top of the head. Now consciously try to relax all the points that your awareness has traveled together at the same time. Complete let go. Surrender the whole body weight to the ground. Now in this position, very gently touch your tongue to the upper palate, very gently, slowly. And keep producing a very, very gentle humming. Like a tortoise withdraws all its organs into the shell. With each humming chant, consciously withdraw your awareness from the senses into your heart. Continue this gentle humming as long as possible, till you get sleep. Very gently become aware of the touch of the ground on your body. Move your fingers and your toes. Become conscious of your body. Slowly join your legs together. Turn your body towards one side and slowly come to sitting position. We shall end this session with a prayer for universal well-being. Adapt Namaskar Mudra. You can also keep your palms facing upwards if you are more comfortable in this posture. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet. Om Shanti Shanti Shanti. This Vedic prayer means, may all the creatures in this universe be happy. May all be healthy. May we see auspiciousness all around us. May no one suffer. Om, peace, peace, peace. Gently rub your palms together and give the warmth to your face, head, ears, and the neck. Thank you very much. Over to Shivram sir and BNG sir.
Thanks, Hemant. I hope all of you are awake. Hemant didn't put you to sleep. It's okay for us in India. It's almost 10 o'clock in the night here, but probably it's not so good for you. People are going to work after this. So this is just a demonstration of what yoga can be used for various disorders. And like we said earlier, this doesn't mean that this is the definitive solution for all problems, but this is something that we have put together. People can make it better, improve it, but the idea is it should be fairly simple, just like what Hemant has taught you. Okay, so we would probably like to show you. You can go ahead, Hemant, if you have those slides, what we are doing right now at NIMHANS. And people wanting to ask questions can go ahead, put questions in the chat box. Maybe he's going to show you. We did a lot of work during the COVID pandemic in terms of taking sessions for patients on tele mode, as well as people, like I said yesterday, a group from the United States of America from Boston. We took some yoga sessions for nearly 6 months. We also have a few studies going on looking at the effect of yoga on various parameters in people who have been COVID positive and mildly ill. That's something that we are going on. Yeah, Hemant. So this is something that we have going on. what time? I don't know. In the US, would it be what time, Hemant?
Sir, I think it will be EST, sir.
That EST is, yeah, okay. So I think this, we have some sessions for stress management, which are open to anybody in the world um, at these times. And this also is available on our website, which Hemant put in the chat box, that nimhansyoga.in. And you just have to log in at the time that you feel convenient. You can give it to your, contacts as well if somebody needs it. Students whom you're helping, people who are under stress can also join. We have been running this almost for more than a year now, since the start of the COVID pandemic. And this is the team that makes all these things possible. Dr. Gangadhar was the director of NIMHANS and the leader of this team. And although he's no longer the director, he still continues to lead the team. And these are a group of our therapists and the other staff. And right now, I would request Dr. Gangadhar to give some comments, particularly on the basic biology of yoga and mental disorders. And any questions come up, we can answer in the next few minutes. Yeah, Hemant, people want you to share that slide of Zoom meetings again.
Okay.
Dr. Gangadhar, you can go ahead.
Yeah, as he is getting ready, maybe I will say a few things about the science behind all what we are doing. But yeah, go on the slides. Maybe people may want to take a screenshot.
I think they want the one, not that, go back. Yeah, this one.
Maybe they will have to have a screenshot preserved for their, or maybe the organizers could store this and also pass it on to as many people as people may want to benefit from.
Yeah, absolutely. We can put it in the product page when we post today's recording and the slides. We can share this as well.
Yeah, maybe you can close this slide. I think that's about it. So anyway, before I go on to the science behind yoga, I believe this is a group of people who have been in the frontline workers in COVID pandemic. So any amount of gratitude is small when we express. We're all alive, we're all healthy, because all of you who are in this audience work tirelessly fighting the COVID on the field. And so on behalf of all of us here, I appreciate and I thank you for the services that you offered in this pandemic. And I keep saying this wherever I spoke to and addressed either doctors or nurses or health workers who may want to participate in a stress management or a yoga session in the periods of COVID. So on behalf of my colleagues, I think you should convey to all the frontline workers in all parts of the world that their service is what is making all of us live and show you what the stress management programs are. Having said that, a few lines, a few important things about yoga and the way in which it's the science behind the yoga. We talked about stress. Whenever you're talking of stress, you're talking of a stress hormone called as cortisol. You're continuously stressed, continuously the levels of cortisol remain high. The longer high levels of cortisol are there, it is deleterious to brain and many other parts of my body. And so we also see that in individuals who are having depression, because they're continuously stressed, their mood is not good, their levels of cortisol has gone up. This elevated levels of cortisol for a long time, as I said, is going to come in the way in which my brain repairs itself. The repairing material called as the brain-derived neurotropic factor drops when I'm exposed to this stress, and as a consequence, elevated levels of cortisol. World over, people who have researched on yoga have demonstrated that practice of yoga brings down the levels of cortisol. And even in depressed individuals who are chronically stressed and having high levels of cortisol, this phenomenon is observed. And yesterday, my colleague Shivram alluded to the brain repair mechanism, brain-derived neurotropic factors having been elevated because of practice of yoga. And we have seen that in those people where the cortisol levels dropped, in them the brain-derived neurotropic factor elevations were quite significant. So there is a relationship between the stress and my brain repair, which finally gets corrected by way of repair induced by the yoga in reducing the cortisol levels. There are many other researchers which have been talked about in many other conditions about yoga and physiological effects, which are conducive to giving a better health than what we already have. But more importantly, in terms of the emotions and yoga, this is the last part I thought I will make a comment. We all hear that yoga means to connect. Yoga means connecting my personal consciousness to that cosmic consciousness, a spiritual transcendence. However, all of us may not practice yoga so devotionally and so long enough, and the way in which we have to practice. So we probably never ever achieve that level of transcendence spiritually which yoga ought to produce in all of us. But nonetheless, in this journey of connecting my personal consciousness to the cosmic consciousness, I will probably start connecting to neighboring consciousness. I feel one with others. I feel to have this compassion and empathy with others near me. And this connectedness is another experience that most yoga practitioners report in their initial stages. And in fact, it has been conducive, this effects of connectedness feeling is conducive to improving depression and improving some components of schizophrenia as well. And how does this connectedness come about when you practice yoga? One of the hormones called as oxytocin, which is also known as a cuddle hormone. This increases when I practice yoga. And this has been demonstrated in our study in individuals who have schizophrenia. And so, cuddle hormone, which improves this feeling of compassion. And we also have shown that this connectedness manifests in improving the connectedness in the brain as well. The brain works because of the connectedness of the networks. And one of the networks called as the default mode network we examined following practice of yoga in schizophrenia becomes more coherent than it was when they were not practicing yoga. So it looks like connectedness manifests in connecting my mind and body, in connecting the right and the left brain, by connecting sympathetic and the parasympathetic systems, by connecting my own self with my own emotions. I am able to see my emotions and my thought synchronously. I'm able to connect with my neighboring people. I'm able to be emotive, proactive socially, and the social cognition gets better. And all this is in the journey of my connecting my personal consciousness to the cosmic consciousness. And this is why yoga practitioners talk about Vasudhaiva Kutumbakam. World is a family. We are all together. And this connectedness comes in by practice of yoga. International Day of Yoga has brought that. Yoga connected everyone, every part of the world. Masses and masses of people practicing yoga, indicating this connectedness having come. And that also has been shown to translate itself into several biological phenomena which are conducive to me getting well. So science is there behind yoga. Let's all practice yoga to commemorate the International Day of Yoga on the Monday this month. Thank you so much. If there are any questions, I'm sure there are a lot of questions I was told. If anything could be answered, that would be useful. Shuram, I'll pass the mic back to you.
Yes, sir. I think we are at the end of the allotted time. So I have answered one of the questions on the chat, and I think we could, of course, get a list of questions. If they can, if they have questions, they can send it to our email. I think Hemant, you did put your email, did you? Yes, I think we can answer the questions on the email as well. Most importantly, we need to thank the MHTTC and the SAMSA, Dr. Keshavan, Vanessa, and the team which has worked, Rachel and Raquel, who have worked with us. And we hope it was useful for all of you. And we hope that you would do your own work. Every small research contributes to the global yoga research. And please write to us if you're interested in learning anything more. And thank you very much. Vanessa, maybe do you want to say something before closing the session?
Yes, thank you so much, everyone, for attending today's session. As I said previously, we'll be posting the recording and all of the resources shared today in the webpage. And I'll share the webpage with all of the registrants via email, so just stay tuned for an email. And I wanted to thank all of the presenters today for a great session and for everybody who was here attending with us. And if you do have any questions, always please email us at newenglandmhttc at mhttcnetwork.org. Thank you so much.
Thank you, Vanessa. Thank you, everybody. Have a good day.